In this gap, we will be discussing the language processing disorder. We will cover its definition, causes, characteristics, prevalence, and services. Definition: a language processing disorder can be described as having extreme difficulty understanding what you hear and expressing what you want to say. LPD is a specific type of auditory processing disorder. There are two types of language processing disorders: expressive and receptive. Expressive language is the production of language that is understood and meaningful to others. Receptive language is the ability to understand that spoken language of others. Causes. A specific cause of language processing disorder has not yet been discovered. It can be a neurological problem or a developmental disorder, but no studies have been able to trace a specific cause. Characteristics, symptoms. The symptoms of those with language processing disorder are abundant. They struggle in activities like reading, writing, spelling, rhyming, expressing, or labeling. Anything that involves language, they could have problems with it. These problems lead to greater challenges like paying attention or following directions. They are unable to process what people are saying in a fast and efficient manner, causing difficulty in following directions, which is the receptive language disorder. Their writing is often not well either. Even expressing their feelings or thoughts is hard for them, which can cause many to become sad, discouraged, or even depressed, which is the expressive language disorder. Prevalence. It is estimated that up to 5% of children in the United States have some type of language disorder, and today more than 1 million children receive help and special education specifically for language-related disorders. Language processing disorders are puzzling to diagnose since children with language disorders can often be labeled as just shy, quiet, or distracted. Because language communication and understanding are vital for everyday life, people who suffer from language processing disorders and are not treated can encounter hardship all throughout childhood, adolescence, and adulthood. For instance, people with language processing disorder find social settings daunting, and they might withdraw and isolate themselves. Another possible misdiagnosis is because of their increase in negative behaviors that arise from frustration or anger at the child's own inability to communicate effectively and express how they feel. These children may act out or be aggressive simply because they are so frustrated and discouraged. Services. Most children dealing with language processing disorders are able to stay in general education classrooms. Upon diagnosis of a language processing disorder, usually by a speech-language pathologist, speech therapy is recommended. IFSPs and IEPs can be evaluated and discussed as well depending on the age of the child. Psychotherapy may be needed depending on the child's experience with their disorder. Strategies for instruction. Various strategies and techniques can be used when teaching someone with a language processing disorder. Speaking with minimal words as to not confuse them and not too rapidly to give them time to process the information will aid them in their understanding of what you are telling them. Whenever visuals can be added, they should be used. Their visual reasoning skills can help them follow along and express their own knowledge of what is being discussed. Excessive noise should be avoided for children with LPD to prevent distraction and not make it harder for them to listen to instruction. They should also be given ample time to respond to questions because of the longer time it takes them to process what they hear. Whenever possible, they should also be allowed additional time on assignments or tests. When giving commands or explaining something to children with LPD, it should be done in small chunks. They may have difficulty doing multi-step actions. These are references and points for further education. Thank you.